Hello everybody, I'm Dr. Raktin and I'm here to discuss on a very important topic of measurement of morbidity. Let's begin. What is morbidity? It is defined as a departure, subjective or objective, from the state of physiological well-being. That means it is a state of being diseased or ill. There is unhealthy population. The patient or the person here doesn't die, but they have some sickness or illness that pertains to morbidity. There are many more indicators of morbidity, but the common ones we are discussing it in this presentation. These are incidence and prevalence, notification rate, admission, readmission, and discharge rate, and lastly, the duration of hospital stay. Coming to the incidence. What is incidence? It is the occurrence of new cases of a specified disease in a given population at risk. It is generally measured by conducting longitudinal studies like cohort studies. So, it helps to assess the risk of getting a disease in the population. It is crucial for the detection of outbreaks. Okay? And with that, the planning interventions of the government or any agencies, they will evaluate the control programs of a disease. These are the importance of incidence of a disease. Looking forward to the prevalence. Prevalence is the total cases in a given population over a period of or a point. It is generally measured by the cross-sectional studies. Cross-sectional studies are also known as prevalence studies as they measure the prevalence of a disease. It measures the burden of a disease in the community. It is valuable for planning different health services, the allocation of funds to a certain program or to a certain area. Mathematically, prevalence is known as incidence multiplied by the duration of disease. The basic difference between the incidence and prevalence is the incidence focuses on the number of new cases, while the prevalence focuses on the number of new cases as well as the old cases in a specified defined population at risk and in a defined period. In a prevalence, there are two types. It is point prevalence or the period prevalence. When you are collecting data in a certain point of time, it is known as point prevalence. It is the snapshot in the population, while the period prevalence is the data is collected over a period of time, say 1 year or 5 years. Most commonly, the cancer registries are maintained every 5 years, and we generally tend to find out the um, survival period of a cancer patients for 5 years. This is the prevalence of a disease. Okay. Then comes our notification rate. Notification rate are the number of cases notified for a particular disease, and it is generally calculated per 1 lakh population in India. Okay. It is an important indicator for the health surveillance. It quantifies the disease burden. It prioritizes the public health efforts and monitor control programs. How many cases are actually detected in the population and formally recorded is found out by the notification rate. Hence, this is very important because you will never know how many cases of a particular disease are present in a population just by the prevalence. It should be notified to the health authority so that you will actually know how much is the true disease burden. So to know the true disease burden in a community, we should always uh, pinpoint our focus to the notification rate of a disease. Some of the commonly notifiable disease which is mandatory, and if you miss you would be punished under law. These are the tuberculosis, measles. Okay. And if there is low notification rate of a particular disease, it means the poor case detection. It may be because of various factors, but particularly we should focus on the notification of a disease. We may think that that person has the disease or not. We have to get it confirmed, but to get it confirmed we have to focus on notification. Moving forward, coming to the admission rate of disease. Admission rate is the proportion of people who are attending the OPD and getting admitted to the hospital or the health facility. It reflects the burden of a disease and access to care of that individual or the community. Because care, big prevalence will give you the burden of a disease. Notification will give you how many cases are there in the community. But admission rate will give you the how many cases are there in the community who are getting admitted. This will reflect the severity of the disease, the health seeking behavior of the community, and finally the true burden of a disease in the community. Readmission rate again is a very important indicator, and it is used as a quality of care indicator for a particular hospital or the health facility. It again points towards the severity of the disease, how effective the healthcare system of that particular area or the community is, and finally the post-discharge care that is given by the hospital to the individual or the community for that disease. Next, coming to the discharge rate and average length of hospital stay. Discharge rate is the number of inpatients discharged from a hospital in a given period of time. In India, it is generally calculated per 1 lakh population. Discharge rate will give you the bed turnover rate for a particular disease. It is important to know how severe the disease is, what is the policy of treatment, and is a very useful indicator of hospital service delivery to the population. So, thus, discharge rate will help us to compare the service delivery of a hospital, the workload of the hospital, and how effective their treatment is across regions. Thus, when we monitor the admission rate, the readmission rate, the discharge rate, it will help us in capacity building of our staff, the planning of discharge at a proper and appropriate time, thus leading to better healthcare service delivery to the population. Our final point is the average length of hospital stay. Mathematically, the average length of hospital stay is the total inpatient days divided by the admission. When we say inpatient days, it means that how many inpatient or the admissions have occurred, those who have visited the OPD, and how much duration that patient has stayed in the hospital. When we multiply both, it gives us the inpatient days, and when we divide it by the total admissions, then we will be getting our average length of hospital stay. It is used to measure the efficiency of the hospital. Then coming to the how severe the disease is, the efficiency of the treatment given by the hospital, and how meticulously the resources have been used by the hospital in uh, treating the disease. Thus, it compares the hospital performance, then optimizes the bed use, and finally, it manages the costs or the infection rate of the hospital. Thus, these were the common morbidity measures for the hospital. There are many more measures to it. We would be discussing it in separate video. So for now, let us recapitulate what we have read. So we came across the incidence, the prevalence, the notification rate, the admission rate, the readmission rate, and the discharge rate, the average length of hospital stay. That was all for today's lecture. Thank you so much. If you have any question or comment, then you please comment in the chat box. We will have our further discussions. Thank you very much.